Breast augmentation is one of the most common cosmetic surgical procedures in the country, but now women don't even have to go under the knife to go up a cup size. And they don't have to commit long-term either. That's right, temporary vacation breasts are making headlines as a New York doctor has created an injectable saline solution that's said to enhance bust lines from a couple of days to up to 3 weeks. My first guest, Amanda Sanders, had the procedure done twice, and she joins me now to talk about her experience. Welcome, Amanda.
Hi, thank you for having me.
Thank you so much for joining me. So start me off with how you decided to go about this procedure the very first time.
Well, I'm an image consultant, and I'm in the business of vanity. And, there's all sorts of bras and sticky tapes and all sorts of things to do with your breasts to put them into the right dresses. But there's nothing like really having implants that will put them in the right place. So I work with Dr. Rowe all the time, and he sort of said that he was doing this for some of his clients that were interested in having their breasts done to really understand what the cup size would feel like. And I thought, well, no time like the present. I had a red carpet event, and I thought it would be really fun to try.
So what did going up the cup size actually feel like?
I'm a mother of two, so there certainly was a fullerness in my breasts in terms of feeling and in weight. Not only was there more volume, but they looked fuller. And, something that perhaps a woman who's had children would understand from breastfeeding.
Now, how long did the actual procedure take from sort of start to finish, and was it painful?
Oh, it wasn't painful at all. I'm, again, somebody who's in, the beauty business, so this wasn't the first thing I've had done. So I have no issues with needles. You certainly don't need to be squeamish, but it was a very short, procedure and an immediate reaction.
And there was no sort of recovery, any sort of tenderness?
There might have been a little more tenderness, but again, it's, it depends how sensitive you are, how sensitive, some women have more sensitive breasts and women have less sensitivity. But for me, it was literally nothing. It was about getting me into the dress and filling me in for the dress.
How noticeable was the difference? I mean, did your sort of friends, your families, did anyone notice when it got done, or were people just saying, hey, that's a great bra?
Yeah, it was more or less like, hey, that's a great bra. Because, a great bra makes all the difference if you don't have implants, truthfully.
So tell me, from your professional opinion, what is your take on these temporary procedures for breast augmentation?
Well, I would recommend people to exercise caution because none of these procedures have been studied on lots of patients. You may have one or two people that have the treatment done. They say, wow, I really liked it. But what about the thousands of people that really need this? This needs to be tested on before we kind of recommend it to the general population. I mean, breasts are a cancer-prone organ. 1 in 9 women will get breast cancer in their lifetime. So any procedure, especially surgical, that we do to the breast, we have to be very careful, make sure it doesn't increase the risk of breast cancer or delayed diagnosis or interfere with mammography screening.
Now, do you see a strong desire for many of your patients to want these temporary fixes or the sort of try before you buy?
Yeah, I mean, we actually use temporary sizer implants in my office where you can put them in a bra. You see how they look. We have a computer imaging program where it takes a 3D picture of your body and you can get an idea of how implants would look. The problem, first of all, with injecting saline into the breasts is the average breast implant is probably about 325 to 350 cc's. Now I'm going to show you, this is a syringe. This is a 60 cc syringe. An average breast implant is 5 or 6 of these. So can you imagine if you're really going to test drive an implant, you're going to inject 5 to 6 of these syringes into your chest? That doesn't sound like a very good idea to me.